Hi, everyone. Thank you for tuning in.
We're live already?
Yes.
Oh, hi. You usually tell me.
I'm telling you, we're online.
You tell me once we're live.
We'll give everybody a few minutes to sign on.
Yeah, we're going to give everyone a few minutes to sign on. I think we as soon as we sign on, we usually start talking right away, but I'm just,
Oh, we need to clarify.
let's wait till more people log in. There's a few clarifications we need to make as soon as you all start logging on. So give me 1 second. I'm not ignoring you. This is how I have to share the videos.
Do we have to agree to share? For me?
For me?
You tag me. Or I tag myself, but...
Yeah, it's right here. I gotta go review it. Okay, just a few more shares and then we'll start our video. So for those of you that didn't see who won our share giveaway from last video, there was actually 3 people because the amount of shares that we had were like extreme. We had a lot. So again, they were Sochi Norte Guzman, Victor and Gabby Honorato, and Jessica Marie. I did message you information about giving me your address, and we will send those watches out as soon as possible. We'll let you know as soon as they've been sent out as well. One more.
Well, how that works, if you're watching, go ahead and share the video to all your friends and anyone interested in subjects related to OBGYN, reproductive medicine, teen pregnancy or teen STDs, and also anything to do with Essure. We wanted a shout out to all of the wonderful ladies from the Del Sol Teen Center we met with today. So for all of you that don't know, that I've I've agreed to start delivering at Del Sol again. I had up for the past 5 years preferred to have delivered at the hospitals of Providence, but since we plan on moving soon, we're trying to reestablish the option to deliver at hospitals closer to where I'm going to be living, which is going to be the closest one would be the Del Sol Hospital, and because I don't have privileges at the hospitals on the Providence East Side. So
I want to show you guys our share giveaway. I did see that we have quite a few men who share our video.
Well, it's not that a woman wouldn't like this, but I think the guys would probably be more interested.
I have seen a lot of women playing with this, believe it or not. So it is an Atom 1.0 micro drone. It's for indoor, outdoor use. I have one here, but my nephew got to it last time and he broke a propeller. This one's mine. This one's mine here. It's a little mini drone, really cute. I play around with my dogs with it, or anyone really. So, people of all ages can literally play with this. You just, it says on the box ages 10 and over. So.
Well, anyway, my suggestion is, ladies, if your husband or boyfriend is playing video games or they're watching a game and they're ignoring you, if you get really proficient with the little with this, you can actually fly it up and hit them right on the head with it.
Hold it on your palm like that. I'm not going to fly it around everywhere here because we do have some lights here and I don't want it to penetrate the cloth. So the propellers do spin really fast and they do hurt if you hit somebody in the face, so I have to be careful. I get all excited. It just has to connect. Yeah, I don't want it to take off, but it's really, really strong little drone. Yeah, okay.
So
Be
remember,
careful.
get good at it, and you can hit the guy right in the side of the head with it, okay, if he's not paying attention
So
to
I
you.
thought this was really, really cool. And the one that we're raffling off for the share giveaway is a blue, brand new in its box. The one I have here is my little drone.
So go ahead and keep sharing. If you're joining us, please have your questions ready. I do have some specific subjects that I'd like to talk about. There's 6 of them. And hopefully we can get everything in within an hour. That's what our goal is, 45 minutes to an hour.
So I do have, hold on, a few clarifications.
Yes. Listen, we appreciate, because anywhere between 10 and 15,000 people watch the videos. Unfortunately, we do get an occasional commentary that actually is kind of bothersome, because we just don't think on that same level. But anyway, we did get a...
I won't mention who it was,
okay.
But they were bothered at the fact, that the picture behind me is a pregnant woman, and of course she's not wearing any clothes, but she's not exposing herself completely nude. We did receive a comment stating that it was me in the picture, and it was inappropriate for us to do it. For us to have that picture back there, you guys, I'm barely 4.5 months pregnant with my first child. That is not me in the picture. These pictures were done by a professional photographer that were later on given to Dr. Novoa so he could use them in his office. I think it's a beautiful picture, but it's not me. Thank you, but no,
yes,
it's not me.
It's not meant to be obscene. It's meant to be appreciative of the fact that women who happen to be pregnant are beautiful. And that's why I liked having it in my office as an OBGYN, and why we got literally hundreds of commentaries in a positive manner about it. But apparently it rubbed somebody the wrong way, and they made that comment. And that was number one.
Number two is, yes, I'm looking down a lot, and the reason why I'm looking down a lot is I'm on my phone, and I can see my own live there with the comments coming in. He's the one who's going to be mainly speaking to you. Every now and then I'll throw in, hey, this or that. But the reason why I'm constantly looking down and making sure the video is not freezing is because I need to, you guys are saying hello right now, or you have, questions. So he can't answer your questions at the same time that he's speaking to you. So I look at my phone so I can relay the questions to him. That way we can try to get to all of your questions, just to answer all your questions.
Yeah, we're trying to be professional about it.
I'm not trying to be rude, but it's mainly he's the one giving out the information, and I help him by, assisting him in reading off questions and bringing out good points that you guys do bring up every now and then. So I'm not ignoring you. I will speak to you guys every now and then if I have something to say, but other than that, he's the one he'll be speaking to you the most.
Well, this is our presentation, so obviously, and especially since Danielle is pregnant, I think it's appropriate for her to be answering questions about her pregnancy to help other women. And again, no matter how much I appreciate women, I'm not a woman, and so I can't always think like a woman who happens to be pregnant thinks, although I try, because as an OB, that's our main goal, is to really appreciate the thoughts and concerns of our patients. But this is her first baby, and so she's got a lot of first-time mother questions, or soon-to-be mother questions, and that's why I have her helping me. Besides the fact of the matter, she gives her impressions of a woman. I give my impressions as a man, her more as a medical assistant, and my eye as a doctor. But we try to answer everybody's questions and thinking about everybody's mannerisms. So we apologize, and again, I don't think we should have to apologize by the way that we present, because we are trying to do it in a positive way. In any event, that's what we wanted to clarify first. I think that it's important to address constructive criticism in a positive way, and that's what we're trying to do today. So let's go ahead, continue to share the video.
I'm gonna put this here.
Again,
I don't know if they can even see it.
I guess we can just keep going like that every few minutes.
It's a mini drone, guys.
It's a mini drone for your husband or for
powerful.
yourself. Yes.
Very powerful. Really cool little drone. That's our giveaway.
That's our giveaway. Okay, so let's go ahead and start. As all of you already know, that I'm a very, very strong advocate for women's health care, and one of my main projects has been to try to get the Essure permanent sterilization device off the market. And I know everybody's entitled to their opinion. Every doctor is entitled to their opinion, but most doctors know very little about the potential problems and side effects of Essure. And even doctors that put these devices in don't know a lot about the product and its complications. And so what we're trying to do is I want everybody to read up on the Medical Device Act, which we're trying to get through Congress. Please sign on to all those petitions. And basically, these medical device acts are out there for you. You have to understand that the system is rigged. When you think that there is a device out there that's safe and effective, in the majority of cases, it's had very little study, very little follow-up on it. Because why? Because the FDA created a system which over many, many years, manufacturing companies have been able to figure out a way to get around the system or use the system to the disadvantage of the consumer. And it takes a huge amount of time, effort, and money to change a system that is corrupted, not by necessarily those people that are really wanting to work within the system, but those people that want to manipulate the system. And that's what's going on. That's what one of the Medical Safety Act is supposed to do. And so please support that, because even I, as a doctor, did not know a lot about what was going on until I educated myself about 5 years ago. And it took me just a little while, but most of my colleagues just don't want to bother with it because they don't believe anything. It's all fake news, quote unquote, when it has to do with these medical issues. And that's not the case. It is a very important subject, and you, in many cases, had to educate your doctor about them. So let's go ahead, and I wanted to also address, please, if you have the opportunity, please see the movie, the documentary, The Bleeding Edge. We're trying to get that into high schools. We're trying to get that in the community setting. So it will be available to be seen on Netflix in July. But really, we really want as many people to see that. If you don't have Netflix, obviously, you're not going to be able to see the documentary without a little bit of work. So that's what we're trying to do in getting it ready, getting the message out. So if you have an opportunity, watch the documentary, The Bleeding Edge. If you have an opportunity, please read up on the Medical Safety Act and try to and support it, please. And let's go ahead and start with the first subject today, which is, again, an Essure subject. But I've kept reading this week about the posting, specifically the question about how can the coils of the Essure permanent sterilization device migrate? Okay, how is it possible that a device is placed inside of the fallopian tubes that's scarred in place? How can it possibly migrate? And 9 times out of 10, you're going to hear from your doctors that this device, or that almost 100% of the time, you're going to hear from your doctors that this device cannot migrate. Okay, that's absolutely not true. Again, I say it with absolute confidence in saying this point. The Essure device will migrate in a significant number of patients. So how do we know that it migrates? Well, we knew that from the original studies. The original studies, and when it got through FDA approval, this was a question that was discussed. What happens, first of all, in 14% of cases, you can't even place the device properly. So if it's more than 1 out of 10 times you can't even place the Essure device properly, then those devices are in the wrong place, okay? And so most of the time, for patients that are concerned about an issue with a device having migrated, in reality, it was never put in the right place. And this is where doing the post-operative ultrasounds and HSG tests are exceptionally important. You cannot assume that you can simply say, oh, my doctor didn't think it was important for me to do an HSG test, and therefore I don't have to do it. Yes, you absolutely do, because you have about a 1 in 10 chance that that device is in the wrong place. A 1 in 10 chance that it's going to be in the wrong place. So where is it going to be? It's going to be through your uterus. It's going to be near a major blood vessel near your ovary. It's going to be up against your bowel. It's going to be piercing against your bladder, okay? Or it may be as high as your diaphragm, okay? So these are the things that you have to remember, that the coil can be in the wrong place right from the get-go. But then let's talk about its migration. Why would it migrate? Okay, let's assume, mind you, that the coil is exactly where it's supposed to be, that it's properly placed inside of the center of the fallopian tube. Okay, the coil is designed to cause an inflammatory response that causes scar tissue to form around that coil. Okay, and when the scar tissue forms around the coil, it blocks the fallopian tube from working, from allowing the sperm and the egg to meet. That's the theoretical portion behind how Essure works. Here's how it migrates. The body never really stops forming a scar tissue. It never really stops having an inflammatory reaction to that coil. So, unlike a perfect circle where that coil is dead center, okay, a portion of the coil will be pushed up against the lumen, or the center of the fallopian tube, and over time, that scar tissue will continue to push and push and push and push until that coil pierces through the fallopian tube and enters the pelvis. So there is an erosion of that fallopian tube when that happens. The inflammatory, if you ever had family members with bed sores, or if you know how that happens, it's because there is a constant irregular pressure against a particular area of skin, okay? And over time, that skin will break down, and it doesn't have to be a lot of pressure, just a little bit of pressure. That same thing happens with the fallopian tube and the Essure coil. Over time, that scar tissue, that inflammatory response will continue in some patients, pushing and pushing and pushing that coil against the more fragile natural tissue of the fallopian tube, and pop, a portion of that coil will come right out of the fallopian tube. In many cases, that coil will go right through the uterus, right back out, and a woman 5 years later may go to the bathroom and she'll look down and she'll have the Essure coil come out of her vagina and hit the floor or hit the toilet. And we see pictures of this all the time. So we don't mean to scare you, but you have to be ready and have to understand that these coils migrate. And any doctor that says that they don't, I call bullshit on them, okay? Because they don't know what they're talking about. Okay, they absolutely do not know what they're talking about. If you've got a doctor that says that to you, you need to find another doctor. Okay, so that's why it's important to know that it's been properly placed. That's why it's important to do the HSG test. That's why it's important not to assume that this is going to stay in place 5 years, 10 years out from its placement. Since it was available back in 2002, we have a significant number of patients that have noticed migration this far out, which between 5 and 10 years. And so that's my answer to how does the Essure coil migrate and why does it migrate? Okay. Along with migration, along with improper placement, you're going to have unexpected pregnancies. Unexpected pregnancies. Obviously, you wanted this coil in there to stop you from getting pregnant. Another take-home message, ladies, please. If you have had a miscarriage following an Essure device placement, you're fertile, okay? You're going to get pregnant again. So I really, really need you to understand that if you're having consistent miscarriages, if you're getting pregnant with the Essure device in place, you've got to have another form of birth control on board, or you're going to wind up getting pregnant over and over and over again. And one of them is going to lead to an ectopic pregnancy. One of them is going to lead to obviously a continued miscarriage, a stillborn birth, or a catastrophic situation for you. So please, if you've gotten pregnant after the Essure device has been placed, please use some other type of birth control. And as I always say, the best type of birth control is the male vasectomy. So all of those men out there that are married to women that have the Essure device in place, it's your turn to get sterilized. It's your turn to get to step up to the plate and do what's right. And it's your turn to do a vasectomy. And I really don't want to hear about, oh, it's going to change my ability to have sex. It's going to, I don't want to have it done because it's going to be painful, or, you need to take care of it. Listen, that's just a cop-out. And I can tell you why it's a cop-out, because it comes from me, not only being a man, but I had a vasectomy. Okay, I had a vasectomy and I was back at work 2 hours after the vasectomy, and it didn't change anything for me, okay? But at least I did what I thought was important. And of course, obviously, I had a reversal of vasectomy, because here we are waiting for little Richard to come. So now when I had the reversal, yes, I also had it done awake, but yes, that was more uncomfortable. It did take... I needed to take a few days off after that reversal of the vasectomy. But here I am as a commentator, not only as a man, but someone that's had a vasectomy and someone that's had a reversal of vasectomy. And the complications related to vasectomy are significantly lower as compared to the tubal ligation. And men generally, in very rare circumstances, do men suffer from similar symptoms as the post-tubal ligation syndrome that women suffer through with the tubal ligation. So men, you can't use that excuse anymore. Ladies, don't accept the excuse anymore. If there's an issue with getting another procedure done, if there's an issue with birth control, your husband or boyfriend needs to have a vasectomy done, if for no other reason because of the significant dangers that are associated with you getting another procedure done, or you having to continue to use birth control, especially if that birth control could potentially fail. So, the next question was when is a positive pregnancy test not really positive?
Oh, can we actually answer some questions
Sure.
that are Essure related?
Sure.
Do you mind?
Go ahead.
Okay. The question was, can you have a reversal if you have von Willebrand's disease?
Yes. Von Willebrand's disease is a clotting factor problem. You have to coordinate with your hematologist and with your infertility specialist. But yes, you can. And usually, just like we deal with von Willebrand's for patients that are pregnant, you can have, obviously, if you're pregnant and you have this condition, you're going to have a significant more bleeding with a pregnancy and delivery than you would with a tubal reversal. So yes, I would tell you, coordinate with a hematologist and with your gynecology specialist, infertility specialist, to have your tubal reversal.
If they have Essure, how can they get it removed?
For a reversal?
I know. It just said complete. This is a different question.
Oh.
How can they just get it removed?
There are different trains of thought related to Essure removal. Number one, thank you for mentioning the question. This comes up over and over again with Essure removal. Please, ladies and gentlemen, please do not let your doctor remove the Essure without doing some pre-op evaluation of where those coils are. Okay, I see it almost every day. Patients are contacting me telling me, you know what, my doctor didn't do an ultrasound before he did my hysterectomy, and they didn't find the coils. Okay, so I'm worried now because the coils may be somewhere. Where are the coils? Where are they? And I say, did you get a preoperative ultrasound done? No. Did you get a CT scan done? No. Did you have an HSG test done after you had the Essure device placed? No. I said, then how does your doctor know how many coils were placed in the first place and where those coils were 3 months after you had your surgery? They don't. And as I told you before, those coils will migrate. So by the time you have surgery done, there's a high probability that the coils may not even be in the fallopian tubes. So I'm happy to say that for those patients that those coils have actually been expelled through the uterus and through the vagina or were never properly placed in the first place. They're not in the uterus, they're not in the pelvis or not in the abdomen. That's great. But for all of those other patients that have had a hysterectomy or a salpingectomy, removal of the tubes, without some type of preoperative evaluation of where those coils are, they were wrong. That's below the standard of care. That's malpractice. Okay, so in order to determine what type of operation you should have for removal of the Essure coils, you need to know where they are. And so the recommendation is to either have an HSG test done, a ultrasound done, a CAT scan done, or a combination of any of those, including an X-ray. I always recommend an ultrasound and an X-ray because that's the least invasive, least painful, and generally very informative. HSG test is actually very, very good at identifying the exact location of a coil. Plus, it's based on a grading system, grade 1, grade 2, grade 3. But you only really need to know the grading system of a coil if you're going to keep the uterus behind. If you're going to leave the uterus in place and just remove the coils, then you need to have a grading system and follow the grading system. Because a grade 1 where more than half of the coils in the uterus is an extremely difficult procedure to remove because by simply just taking the tube out, because the majority of the time you're going to leave in a significant number of times you're going to leave a piece of the coil behind because you cannot remove the coil in a grade 1 position laparoscopically or as an open procedure because you really can't see all of the coil because it's inside of the uterus. So that's why HSG test done, grading system is important if you're only going to remove the tubes. I am an advocate for removing everything as a single unit, removing everything as a part of a hysterectomy, removing the uterus, the tubes together as a unit with the coils inside. For those doctors that opt for recommending only the fallopian tubes be removed, then you better know where that coil is and how far into the uterus it is, and that's what the importance of the HSG test is. And now it doesn't really matter if you do it as an open procedure, laparoscopic, or by Da Vinci robotic. Where I don't recommend doing a hysterectomy is vaginally only without cameras above, because a lot of times you can't see the entire fallopian tube when you want to remove it.
Just confirmation here on how they should be removed, not pulled, but like what you're saying right now.
You have to understand that a lot of doctors that are trying to remove these coils have no experience in removing them. They're just kind of like imagining, well, they went in a certain way, so I guess I can just pull them out that way. You can't. You shouldn't. If you start pulling on the coil, it's like having a slinky inside of cement. You can only do so much to get the coil to move, and then after a certain point, you're going to snap it. Okay, so if this coil is embedded in scar tissue, even if you're starting to dissect the scar tissue out, there's a high probability that you're going to snap the coil if you're simply pulling on it. And doctors a lot of times think that they got the whole thing, they pulled it out because now the coil is this long when it was this long, and they said, oh, I got it all. And you won't really know that until you have a post-operative x-ray done. And again, for those patients that do opt to have only the fallopian tube removed with the coil inside, please request a post-operative x-ray, both a front and back and a lateral x-ray to make sure that the coil is out completely and that there's no fragments that have been left behind.
Can it migrate after years of placement?
Yes, it is. It can migrate after years of placement. We have seen that even 9 or 10 years out that the coils continue to migrate because, as I said before, the inflammatory reaction is not temporary. It's a chronic inflammatory response that can occur continuously for years. That's why I told you to put them up on the second floor. Our dogs are doing, I don't know what they're doing upstairs right now. It sounds like they're
you can hear them running.
It sounds like they're roller derbing up there. It sounds
like
we're
horses.
underneath. No, it sounds like we're underneath a bowling alley right now. And they're two little dogs. One's a Pomeranian, and
one's like 5 pounds, and the one's like 4.
A toy poodle and a Pomeranian.
Okay.
Sound like two polar bears rolling a bowling ball up there. Go ahead.
Have you heard of having one coil, more than one coil in each tube?
Yes. I've seen X-rays of up to 5 coils. One in the abdomen, one just hanging out of the fallopian tube, one inside of the fallopian tube, and on the other side too. So there's dozens of pictures. And if you've seen dozens of pictures, then that literally means that hundreds, if not thousands of women have more than 2 coils inside of their bodies. Because you know why? Because the techs that are not doctors, some of these techs were telling doctors, don't worry about it, you can put in more than 1 coil per side.
Are they allowed to put Essure in with the tilted uterus? And can Essure cause the uterus to tilt?
No, the uterus cannot tilt being caused by the uterus. Now, the uterus is shaped like an upside down pear, okay? And generally it's curved. So if you look at a pear straight up and down, that's not how most uteruses look. They either bend forward or the fat end bends back, and that's whether or not you called anti-flex or retroflexed. So the reason that you have issues with trying to put Essure coils in when the uterus is flexed is that you can't really put the camera in well, the hysteroscope in well, and you can't see the openings to the fallopian tubes very well if it's flexed too far forward or flexed too far back. So it increases the potential complications of placing an Essure, but it doesn't cause you to either bend the uterus because of it, but it makes it much more difficult to place an Essure with a flexed uterus.
Who can remove the Essure, and why are doctors ignoring the side effects and are giving patients a hard time on removing the coils?
Well, honestly, the majority of times when you're getting a hard time from a doctor is because the doctor really doesn't have any experience in removing an Essure coil, and they just don't want to look like they're dumb. Okay, that's pretty much the bottom line there. And so what do? They go back and they regurgitate the information that the text told them a long time ago, and basically they're just being naive. Most doctors don't even take the time to read the clinical manual that they're required to read in order to get certified on the device. And so I keep telling this over and over and over again. Your doctor is no different than any other person. And if you confront a person and you're smarter than they are, that person will shut down and will not want to help you. And so when you're smarter than your doctor, or you're telling your doctor something that they should already know, they get very defensive about it and don't really want to hear anything more that you have to say. So that's why you really have to find doctors that have experience and are open-minded about it. And unfortunately, if 10,000 doctors have placed the device, you're only going to find about 100 doctors that really know how to remove the device. And I'm sorry that it's so hard to find doctors that are really experienced in removal, but that's what's happening right now, and that's why we're doing these live feeds to try to answer some questions and basically tell you guys the truth, because we're not in this to sugarcoat anything. We're in this to tell you the truth so that we can stop women from suffering years of pain and financial burden and loss of social lifestyle with their friends and their families because of this device.
Okay, have you heard of nodules, Essure causing nodules? And a lot of women are saying, they've had severe bloating and swelling from the Essure.
Well, nodules, I'd have to try to ask exactly where they are, because uterine fibroids are commonly seen with Essure, but uterine fibroids are commonly seen even without Essure. 1 in 3 women will have uterine fibroids or leiomyomas. Some women also get concerned because they get Nabothian cysts. Nabothian cysts are little cysts that form on the cervix, and that's actually a very natural thing that happens. Nabothian cyst formation are natural, and they occur in women even without Essure. So I'd have to kind of take a pass on trying to answer what nodules are, unless we're trying to get very specific on whether or not it's a fibroid.
Well, the swelling and then the severe bleeding with clotting, why does Essure cause that?
Okay. The Essure causes severe bleeding because it is a mechanical device that's irritating the lining of the uterine wall, causing an inflammatory response, causing the lining to break down causing excessive bleeding. That's basically the scenario. So what do so many doctors get wrong? So many doctors say, oh, so this patient's having bleeding. Let me put her on birth control. Let me put her on the Depo-Provera shot. Let me do an ablation, a uterine ablation. Let me do all of these things that I would normally do in cases where the patient was bleeding, but there wasn't an Essure device in place. And I'm telling you, they're getting it wrong all the time. The Essure device is causing an inflammatory mechanical insult to the uterus that cannot be overcome by the use of birth control pills, but by the hormonal management in the vast majority of cases. So you're just wasting time and you're making a woman suffer months or even years by not doing the proper management, which is get the coils out by either an experienced doctor that can remove them from just salpingectomy, or an experienced doctor that knows how to remove everything out as a unit. You don't really have to be that experienced. It's a doctor that's good. A good gynecologist can do a laparoscopic assisted vaginal hysterectomy, bilateral salpingectomy, and Essure removal without having ever removed an Essure before, as long as they keep everything together as a unit. So,
what does Essure cause rashes, and what about endometriosis?
okay.
She never had it before Essure until she had it removed. Her doctor told her that it might have been actually caused by the Essure.
Okay, the bloating, back to the bloating, back to the rashes, back to all of the other autoimmune. These are all autoimmune reactions, okay? If we're talking about chronic migraine headaches, we're talking about cognitive changes, memory changes, symptoms of dementia or Alzheimer's, the seizures. We're talking about whole body rashes, similar like you had an allergic response or hives, visual changes, the inflammation of teeth and gums causing your teeth to break or to fall out, excessive weight gain, water retention, the e-belly, joint pain. All of these are autoimmune reactions to either the PET fibers or the nickel or the metallic component of the Essure in many of these patients. Now, we're not sure whether or not these patients were always going to get these symptoms as they later in age, because it's more common in women to have autoimmune problems than men. Or did the Essure make it worse? Did the Essure actually cause it to happen? Or was it always going to happen, but it made it happen earlier and made it happen in a worst case scenario? So this is what we don't know. And so the same thing is applicable to endometriosis. For those patients that understand for those doctors too, that understand the concept of endometriosis, endometriosis is very common in women. It occurs in approximately 15% of all women, as high as 20% depending on the study that you're looking at. So endometriosis is a relatively common occurrence at any age group, but obviously it's most often in women between 30 and 50. So since endometriosis is believed to be caused by an inflammatory or a breakdown of the natural tissue barriers in the uterus, then Essure causing a natural breakdown of the tissue barriers or the tissue lining can also worsen endometriosis, or maybe it did trigger endometriosis and also a similar condition known as adenomyosis.
Questions about ablation before Essure, and is that the reason why it's making her so bad? I guess the reaction as far as inflammation and vitamin D issues.
Okay, vitamin
because
D.
Of the ablation.
Vitamin D issues happen. Excuse me. Can you call it?
Press decline.
Sorry, I got a call from the hospital. But sorry.
Sorry, and like paused the whole video.
Yeah.
Sorry, we're back.
Vitamin D issues will happen in patients. We've seen that happen with calcium issues, vitamin D issues that happen with patients with Essure. So we're not sure what the actual cause is, but we do seem to see an association with it. What was the other part of the question?
The questions, like once they go so far up, is that the ablation?
Oh, the ablation. the studies that were done with ablation only were done to see whether or not you could, theoretically, was there any significant risk to doing an ablation at the same time you did on Essure, following the placement of an Essure. And it was shown that if the Essure was properly placed and you had done your HSG test done, then it was okay to do an ablation. But again, just because there's a study doesn't mean that that's what you need to do, because what we found out later was that you can damage the coil by an ablation, and you should never do an ablation at the same time you're doing the placement of the Essure. Never, okay? Because you don't know if you place the Essure proper way, and then you're ablating the uterine wall, then you can't do the HSG test 3 months later like you're supposed to. So that's what we're saying related to ablation. Don't let your doctor do an ablation. Again, that's mismanagement. They're grasping at straws, thinking they're doing the right thing, and in reality, there has been no long-term studies to show that the ablation is actually of any significant benefit, and there's significant data to suggest that it's actually making your condition worse, or could potentially put you at a life-threatening situation if the coil is improperly placed and you have an ablation done, and that coil, the ablation device touches the coil, and you could have a thermal burn of the uterus, of the bowel, or of the bladder.
After Essure removal, if they're still experiencing side effects, like if they still had the Essure, what blood work can be done? And
what we generally recommend are ANA or rheumatoid arthritis panel. We recommend that you go see the rheumatologist because there's a series of IgG anticardiolipins that can be done, a series of autoimmune antibodies or proteins that can be tested for. So please, if you're concerned about Essure still being an issue after it's been removed, please go see a rheumatologist and ask them to run those type of panels.
Same would be for inflammatory response, right?
Same thing for the inflammatory response.
Misty put, my mom was just diagnosed with papillary serous adenocarcinoma, sorry, of endometrium, and we found out that she carries a genetic gene that causes it. How do I talk to my doctor about removing my Essure for me now, and that I can possibly be carrying this gene as well?
I would suggest you talk to a specialist in genealogy, genetic specialist, and we have not seen that the Essure is associated with cancer. However, the fact of the matter is that I would probably just remove the Essure just as a precaution, because we don't have enough data to say that it doesn't cause cancer. We just haven't seen a specific association with it. So I would suggest that you get the information related to your mom's condition, talk to a genetic specialist, and then go ahead and speak to your gynecologist.
Melanie says she's having her Essure. She was diagnosed with adenomyosis. Adenomyosis. Hysterectomy scheduled in July. When should I have pre-op imaging done? He did not recommend, but I want to ask.
Again, it's because they probably don't have a lot of experience with Essure. I generally, or the group of us that do a lot of these removals, we recommend that you have the testing done within 30 days of the surgery, just like when you would have your pre-op lab work done, when you have an EKG, a chest X-ray, pelvic ultrasound, and a CT scan of the entire abdomen and the pelvis. That's what I do. That's what I generally recommend. Again, lab work for your surgery, EKG for your heart, chest X-ray or CT scan of the abdomen and pelvis to locate the coils, to confirm the number of coils, and if you need to, also do a pelvic ultrasound to take another look at the uterus and the coils and the fallopian tube.
What happens to our eggs with Essure in place? Do they just build up in there and rot?
No. You have to understand that even though the Essure is blocking the fallopian tubes in the uterus, your ovulatory system, the ovulatory cycle still works. So every woman that's either had a tubal ligation, has had an Essure done, or has had her tubes removed, even if she's had a hysterectomy and had her uterus removed, if you keep your ovaries every month, your ovaries will still produce ovarian cysts. Every month, one of those cysts will rupture. It will be released as an egg. And basically, your body will absorb that little egg. And so your ovulatory cycle will continue to function all the way up until the time you go through menopause at approximately age 50.
Can you get cancer with Essure?
We don't know. We have not seen any specific association with Essure and cancer. But again, just as it's so hard to get data for everything else, there has not been any long-term studies to evaluate Essure and the possibility of cancer.
Have you heard of ankylosing spondylitis as one of the diagnoses?
Yes, that's along with the other conditions. But again, there's not been a specific association, and we don't know whether or not that patient was destined to have that condition or whether or not the Essure made it worse.
How about vitamin D deficiencies?
Vitamin D deficiencies, we don't know if it's caused by it, but we have seen a lot more patients that have vitamin D and calcium deficiencies that do benefit from diet modification as well as the supplementation of vitamins in those particular cases.
I think those were most of the questions. What's POTS? P-O-T-S.
I'm sorry.
Declining in column ano.
Why don't you?
So he has to step away real. Sorry, guys. He keeps getting calls from the hospital, so he's gonna answer this phone call really quick, and we will be right back to answering your questions. So, I'm gonna try to see if I can read your questions from here.
You know what? Answer the pregnancy test question. Tell me your experience. Dr. Novoa.
Okay, so he wants me to answer a question. He'll be back to answer more of the Essure questions. He just had to step away for a little bit. So yes, we had quite a few questions from patients asking if a faded, I think we've seen it on Essure as well.
Patient's ready.
Okay. He's coming back real quick. What do you want to do?
I think we have to stop. I can answer a couple questions real fast. Sorry, ladies, I have to go. There's a patient ready to deliver, so let's run through these. I don't even know. There's so many questions.
Well, if it's a light faded pregnancy test, and you're still not sure, what's recommended is a quantitative beta ACG, just to be more sure that the test is accurate, because there can be false positives on a pregnancy test. So that would be the recommendation. Now, if that comes back positive, then you're pregnant. But that was a clarification on what.
Well, we see a lot, and I guess this will have to be the last question. We see a lot of patients that will post, or a lot of people that will post their pregnancy test, and they see a little faint line, and they say, "Am I pregnant, or is this a chemical reaction?" And we have to say, you know what, you should follow what the test says, and just because it is it looks like it's positive doesn't necessarily mean that it is. Repeat that test in 3 days and see whether or not it's still positive or getting darker or lighter, and also make an appointment with your doctor. And for all of you that don't know this, which is very not known very well, is that the $1 pregnancy test at the dollar store is just as accurate as the $20 test. And if rather than spend $50 on 10 tests that you're going to run on the same day, spend $5 and do a test every day or every other day until you get an appointment with your doctor. But a lot of times, a positive pregnancy test, it is actually positive, and you've had what's called a chemical pregnancy, and you didn't even know that you miscarried, and you assume that everything's okay, but in reality, the next time you get pregnant, you may end up with an ectopic pregnancy. So if it does look like it's positive, the best thing to do is repeat the test, and while you're repeating that test in 3 days, make an appointment with your doctor to do a quantitative or quality level value of the beta ACG by a blood test rather than a urine test.
We'll try to see if actually we can come on tomorrow to finish the rest of our video.
Yes.
He has to go do a delivery. Sorry about cutting the video short. And no, I saw a question. We do not accept New Mexico Medicaid. I'm sorry about that.
I'm sorry. Hope to see you tomorrow. We'll try to finish up tomorrow. If not, we'll postpone this for next week. And I apologize, but you know what? Babies come when they want to come, and this baby's ready to come. Thank you very much.
Finish.